I tried. Suggestions? Comments? Okay.
Don't actually, show it. A lot of times when you observe, you can see actual atrophy in people's glutes.
I've got tons of that.
Anyway, so I'm going to have you first just balance on one leg. So let me see you stand on one leg. And just 10 or 15 seconds. And let's do the other leg. So he's a little more wobbly on the right. So first, you can relax. So I checked to see, can you do it for 10 or 15 seconds, and what's the quality? So, a lot of times you think about the ankle working more when you're balancing, but the glutes really have to work a lot. And if you balance on one leg for a good 15, 30 seconds, your butt's going to feel tired and you'll feel it there. Next thing I look at is a single leg squat. So stand on one leg again. Let's do the left first. And I just want you to bend your leg a little bit. And up. Okay, a couple more times. Okay, one more. Good. And let's try the right. A little popping and cracking. You're actually not too bad. You're not too bad. Let me see you guys. Okay. Oh, God. Okay, switch lines. See the face like a... Okay, I think I'm going to use you.
Oh, great. I'm more wobbly.
Okay, so let's face them again. So, so do the left first. Down. Okay, and then let's do the right. Okay, so, obviously some people can't do this at all. If you get people who are really, just horrible balance, horrible control, everything is really wobbly. But what I'm looking at is, can they do it? And then I also look at the form. So it should be nice and smooth, and the alignment should be good. So if you look at when she does it with her right leg, her knee wobbles quite a bit, and it's tough. So her knees wobble in and out. So you see a lot of this action. So then, so I think her right side is going to be a little bit worse. If I were to go through a full assessment, I'd test the strength. So I think your right side. Do you have any problems on your right side?
I've had 2 knee surgeries on my right side.
On your right side. So now what I would tell you is the proper form. So proper form, you should have a relatively straight line between your thigh bone and your shin bone. So, this is what tends to happen is the knee tends to go in. When you do a little bit of a squat, proper alignment is the middle of your kneecap should aim towards your second toe. So what I tell people is you should be able to see your big toe on the inside of your knee. So try that. Okay. So she can't really correct it if I ask her to. So a single leg activity would be a little bit too challenging. So we move to like a double leg squat. So I want you to try just kind of a regular squat. Good. And up. And you're pretty good at that. A couple more. And up. Okay. So alignment should be similar with the middle of the kneecap going over the second toe. And then when you do a little squat, you can see your big toe on the inside. So we want to get your glutes firing. So I'm going to have you put this, step inside of that. So any kind of resistance band. Yep, both legs. And you're going to pull it up above your knee. So one move above your knee. Okay, so this I call the toes to chair squat. So this band is providing some feedback to your glutes, and some resistance. So when the glutes are shut off, they just don't fire on their own. So we're providing some input to the nervous system to get those glutes to fire. So we're going to kind of encourage the proper alignment. So you use a chair. This is a little bit narrow, but your toes go straight to the chair. So you don't want your toes to be out. So toes are straight ahead. You pull out into that band. And you aim the middle of your kneecap right there towards the leg. So you got to pull out into the band and sit back. Okay? Trying to keep your chest up. Okay, try that. This toe, heel comes out a little. That heel. There you go. pull way out in the band, and sit back, and up. Good. Okay, what I want you to do now is try to keep your chest up, look straight ahead. About tired yet?
Not yet.
Feel a little bit? Too much?
Not too much, actually.
Yeah, you're doing it right. Keep going. So this knee needs to come out more. Okay. Just step down. There we go.
Okay, yeah, now I feel it.
What's that band? What's that band?
That's just
doing?
called TheraBand. It's resisting the glutes, so she's got to fight into the band.
So you have to hold your knees out.
Yeah, so the knees are out, and I think I was doing the whole cheating thing. Where I felt like I was pushing it out, but I wasn't pushing it out enough.
Yeah.
And I can start feeling it, yeah.
Okay, so the other thing you see, and this isn't specifically for glutes, but it really correlates to the whole kind of stability of the pelvis, and with the squatting and weight bearing activity. As you see how she can't keep her chest upright. She's going way forward like this. Just go ahead and squat right there. You didn't do it before.
Yeah, it's in the way.
Well, it's because my knees are
Your
going
knees are
farther.
going
Yeah,
forward.
this is
Yeah.
forcing me to.
Yeah, so pull out into the band. So much harder. Okay. So what I want you to hold your arms straight up. A little bit better. So you can go ahead and take that band off. So I talked about how the glutes kind of stabilize the pelvis. Obviously, you know, the spine muscles also stabilize the pelvis. I want you to try a deep squat. So now you can bring your toes out a little. Arms straight up in the air, keeping your heels on the ground. Just squat down as far as you can, keeping your arms straight up. Nope. Nope. Get your whole back. Okay, so you see how bad she's doing here, right? You can still sit back like you're sitting in a chair. Okay, so that's a little better. So she's got a hard time with this. So this is something else to provide feedback to get those back muscles firing